Yes, we continue to celebrate women here, but I'm also combining two topics because this week is also World Glaucoma Week. And on set, I have with me Dr. Desiree Murray, who is an ophthalmologist, a well-known ophthalmologist, lecturer in ophthalmology at the University of the West Indies. Thank you so much for coming on the program this morning.
Good morning, Lisa. Thank you for having me to talk about a topic that's near and dear to my
heart. I know because
yes.
You're my ophthalmologist, and I always feel like if I'm at a student, I'm a student at university when I'm with you. And you've brought with you Nurse Anne Lee Peters, retired head nurse, eye theatre of the Port of Spain General Hospital. I'm going to come over and chat with you. And Dr. Tamara Trabole, who's an ophthalmologist in training. And I love the fact that we are spanning generations here and showing women excelling in the field of ophthalmology, in the field of medicine.
Correct, the past, the present, and the future.
Definitely, definitely. So we're combining women and medicine as well. And let's start with that perhaps, in terms of women in the Caribbean. We spoke to Shannon earlier, and you were on set, so you were hearing some of the challenges that she faced.
Yes.
When we're talking about women in this field of ophthalmology, what are we talking about?
Well, medicine in general, the ratio of female to male is actually greater. There are more women who enter medical school.
Is that right?
Yes, because women, as you know, excel academically at all age groups. However, when we come to specialization, there are probably more men than women in ophthalmology. So at the University of the West Indies, for example, we have 3 lecturers. So I'm the female lecturer, and then we have 2 male lecturers.
Right.
But generally speaking, women excel in medicine, and we are very good healthcare providers, and specifically eye care providers.
Yes.
Yes.
And let's zero in on glaucoma this week before I jump over to the other side, because we're speaking all week about the symptoms and treatment and so on. But I see you have a model here where we could actually explain what it is that we're talking about when we talk about glaucoma.
Yeah, certainly. So glaucoma is a disease where the optic nerve, which is at the back of the eye, is damaged due to the pressure within the eye. So the fluid in the eye is produced by something called the ciliary body that enters behind the iris. I'll just remove the lens here, and then it goes through the pupil into the front of the eye, and the cornea it forms a chamber between the cornea and the iris, and then down inside here is the drainage angle.
Right.
And the fluid drains through the drainage angle, and with glaucoma, that angle is either too rigid or closed, and the pressure builds up, and that's what causes glaucoma. So it's a problem with the drainage of fluid out of the eye.
And when we use the drops now, what are we actually doing? Because we spoke about using drops and the fact that persons, that's the treatment earlier in the week.
Yeah, well, the treatment for glaucoma can be drops, laser, or drainage or filtration surgery.
Yes.
So the eye drops are just one of the many ways that we can treat glaucoma. So it's very important to realize that there's surgery for glaucoma as well, because sometimes the eye drops don't work sufficiently, and the disease can continue to progress despite being on eye drops. So some patients use their drops religiously, but it's just not adequate because the pressure, the starting pressure, can be so high that we need more than just drops.
Right, which is important for them to keep visiting their ophthalmologist for the care, to understand when they need to transition to surgery, I'd imagine.
Correct. So the ophthalmologist will have a discussion with the patient about all the treatment options available and what's best suited to meet what we call the target pressure, which is the pressure at which the glaucoma is stable and no longer progresses.
Right. Yeah. Okay, so I want to bring in now Nurse Anne. I'm just going to leave you for a bit and go across, because we're talking about women in the industry and how women have transitioned and in terms of their careers. And you've been the head nurse, right, which is a very senior position, I'd imagine.
Yes.
Tell us about that as a career nurse and being a senior nurse.
I'm actually a nurse for 36 years. Out of those 4 years, I was the head nurse for the Eyes and ENT Theatre. It's challenging, but it's worth it because you see things done. Like Dr. Murray came with some new ideas about glaucoma, and we all were enjoying it, and we do see the progress, and we
Yes.
see patients really recover. So it's a plus for us.
In terms of a woman in leadership, because that would have been a leadership role
Yes.
in the field of medicine,
Yeah.
what were some of the challenges, some of the
Or the-
successes?
Some of the challenges really are not getting some of the things you need when you need them, but the successes when you get them, you do see the progress. You
Yes.
know? Yes.
Yeah. I want to bring in Dr. Tamara Trabally. You are an ophthalmologist in training, and Dr. Murray spoke about, we have the young person now coming into the field of ophthalmology. Why did you decide that you wanted to be an ophthalmologist?
It started in fourth year of med school when I did it as a rotation, and getting exposed to the field. It's both surgical and medical, and I love both arms of that.
Yes.
And then getting passionate about preventing blindness.
Yes.
In the 21st century, no one should be blind.
Mm-hmm.
So joining the field now, working with Dr. Murray, and she's very passionate about preventing blindness.
So Dr. Murray would be
So-
your mentor, for example,
Yes.
in the field? Yeah.
Yeah.
Your lecturer / mentor kind of thing?
Yeah.
Yeah.
And,
Did I just call you out there, Dr. Murray?
So
Yeah.
she's definitely gotten me a lot more passionate, exposed me to different ways that we can prevent blindness and how much we should be fighting to keep patients' sight and prevent blindness in most patients.
What would you say to a young girl who is in high school or probably primary school? We have a lot of young people watching the program, and they're not sure of where they want to be, but they know that they want to do something with their lives. Were you ever in that position, and what would you say to that child?
In terms of me not being in that position, I always knew I wanted to do medicine since I was 5 years old.
Right. Okay.
But in terms of not knowing, I would say explore all your options. Try and picture yourself in different fields. If you have a passion for science or business or history, follow through with that. Don't let anyone tell you can't do it, because you would be going through life. People say, medicine is hard. Don't do medicine. As a female, you don't have a life, or do something easier, like something that would give you more of a life. Dentists have easier hours or something like that. But don't let the hours, don't let a harder social life or a harder work life deter you from what you actually want to do.
All right. And in terms of the final moments, I'm going to return to Dr. Murray right now, who's looking at her colleagues with, so much admiration.
Yes.
Yeah. And how important it is for women to network in the field of medicine, as clearly you're doing.
Sure, networking is important, so especially for female surgeons, because surgery is a male-dominated field, and there's actually a group of women who support each other. And also, sometimes women can get in each other's way, so we try to make sure that we are supportive of each other as female surgeons in a male-dominated profession.
Yeah, okay. And any final advice you want to give as we wrap in terms of glaucoma now, because I know that's your head area to persons out there.
Yeah, I was really moved when I saw Mr. Cazo earlier, and he made the point that his blindness was preventable if he had sought eye examinations earlier. So eye examinations really are very important to detect glaucoma early. So treatment is available, and I'd also like to appeal to all the decision makers to give us what we need to prevent eye care, the necessary equipment in the hospitals and the financial and human resources, so that we can diagnose and treat effectively to prevent this cause of blindness, which is the #1 cause of blindness in the country.
Okay, well, on that note, thank you very much, Dr. Desiree Murray, ophthalmologist and lecturer at the University of the West Indies, for coming and for bringing your colleagues, Nurse Anne Lee Peters, retired head nurse, eye theatre, the Port of Spain General Hospital, and Dr. Tamara Trabally, ophthalmologist in training at the University of the West Indies and Port of Spain General Hospital. I thoroughly enjoyed this segment. We're going to take in a few messages and come right back here on the Now Morning Show after this.